A heart attack doesn't usually happen suddenly. It often builds up quietly over many years. To understand how a heart attack occurs, let's start with the heart itself. Your heart is a muscle, and like every muscle in the body, it needs oxygen and nutrients to work properly. These are supplied by blood vessels called coronary arteries. Over time, things like unhealthy diet, high blood pressure, smoking, diabetes, high cholesterol, stress, and lack of exercise can damage the inner lining of these arteries. When this damage happens, fatty substances, cholesterol, and waste products begin to stick to the artery walls. This buildup is called plaque. As plaque increases, the arteries become narrower and stiffer. Blood can still pass through, but not as freely as before. The heart is already working harder at this stage, even if the person feels fine. Now here's where the real danger starts. One day, that plaque can crack or rupture. When this happens, the body treats it like an injury and tries to repair it by forming a blood clot. If the clot becomes large enough, it can partially or completely block the artery. When blood flow to part of the heart muscle is reduced or cut off, that part of the heart is suddenly starved of oxygen. This is what causes a heart attack, also known as a myocardial infarction. Without oxygen, heart muscle cells begin to weaken and die. The longer the blockage lasts, the more damage occurs. This is why heart attacks are medical emergencies. Some people experience warning signs such as chest discomfort, pressure, shortness of breath, fatigue, sweating, or pain spreading to the arm, neck, jaw, or back. Others may have mild symptoms, or none at all, especially people with diabetes. The key thing to understand is this: a heart attack is not just a sudden event. It is often the final result of years of unhealthy habits and unmanaged risk factors. The good news is that many heart attacks are preventable. Eating a heart-healthy diet, reducing salt and unhealthy fats, staying active, managing stress, avoiding smoking, and controlling blood pressure, blood sugar, and cholesterol can dramatically reduce the risk. Your heart works every second to keep you alive. How you live each day determines how long and how well it can keep doing that.
Subscribe to LiveWellUp on YouTube for more videos like this.